The FDA advisory group is meeting to discuss vaccine data for children aged 5 to 11 years of age on October 26th. Following that, the ACIP, which is the advisory group for the CDC, is meeting the following week to discuss the recommendations, anticipating that the FDA advisory group is going to recommend adding this group of kids to the eligible population to receive the vaccine. The ACIP will meet the next week to kind of finalize and tweak recommendations. So we'll have a better understanding of what's recommended for kids that are less than 12, 5 to 11 years of age. So at this point, there is only the information from the Pfizer vaccine. And for the Pfizer vaccine, for children that are 5 to 11 years of age, they're using 10 micrograms, which is a third of the dose that's used for people that are 12 years of age and older. So for those people, they're using 30 micrograms. For this 5 to 11-year-old age group, they're using a third of the dose. Despite using a third of the dose, they are seeing antibody levels and responses at the same level as people that are aged 16 to 24. This was in a study of a little over 2,000 kids that were aged 5 to 11. When they looked at side effects, they saw the side effects were about the same as those seen in people that are over 12. They didn't see any new side effects, which is important. And the other thing they haven't seen yet in this age group is any myocarditis, which is a big concern that's been raised, that's been seen largely in 18 to 24-year-olds and is still being followed closely. They didn't see any myocarditis in this age group of 5 to 11-year-olds. So the good news is that there are ongoing trials for kids that are even less than 5 years of age. Pfizer is doing studies all the way down to age 6 months. So they actually have this broken down into 2 cohorts. They're looking at kids that are aged 2 to 5 years of age. The vaccine that they're looking at for those kids is even lower dosed than the dose for kids 5 to 11, which is, that's a third of the dose for kids that are 12 and older. So they're dropping it another third for kids that are 2 to 5 years old. And then for kids that are 6 months to 2 years of age, they're dropping the dose again, and then they're going to look at antibody responses and obviously side effects, any adverse effects that may occur. They're anticipating that by the beginning of next year, they may have the data available for the 2 to 5-year-olds, and then shortly thereafter, the data for kids that are 6 months to 2 years. So there is more data on the way. Hopefully it will be as promising as what we've seen with the 5 to 11-year-olds and people that are 12 and older. J&J and Moderna are also doing trials in younger people and children. So that information is also pending. So we're looking forward to them providing some information there so we have some potentially other vaccine platforms for kids as well. So a lot of people are asking about the side effects they should look forward to or anticipate, I should say, when they get their booster dose for their COVID after their primary series. And in the data sets, in the people that initially got it approved and in real practice now, most people are seeing similar side effects to what they saw with their second dose. So they're having a little bit more side effects than the first dose because their immune system is primed. It's seen this antigen before. But most people are having similar side effects to what they experienced with their second dose. So there is a lot of interest in mixing and matching the different vaccines that prevent COVID-19 infection. Primary reason being it adds to a lot of flexibility for people to be able to receive different doses if there's shortages or supply disruptions. One of the other questions has been, is it effective? Does it work? And so we're starting to get some data now. Some other countries outside of the United States that didn't have as great of an access to vaccines earlier on were using the strategy. So we're getting some data from there, as well as some other studies that have been looking at vaccine responses. What that data has shown is that it's promising that mix and matching probably does boost the antibody level a little bit. There was a big data set that was just released looking at people that initially received a dose of the Johnson & Johnson vaccine. If they received another dose of the Johnson & Johnson vaccine, it boosted their antibody levels by about 4 times. But if they received a Moderna vaccine after first receiving the J&J dose, they boosted their antibody levels by about 76 times, so quite a bit higher. And if they received a Pfizer, raised it about 35 times. So both of those were a little bit higher than a second J&J dose. So it does raise the question if we should start looking at using a different dose to follow up the first dose, using different vaccine platforms. And so the FDA advisory group and ACIP both plan to meet and discuss these strategies. I think the best thing to see is that if it is effective, it'll allow a lot more flexibility. They very well may recommend that people continue to receive the same vaccine that they started with, but allow for flexibility if there's shortages of supply or if they're having trouble accessing the same vaccine they started off with. So if your antibody has dropped after you've received the COVID vaccine, it doesn't mean that you have less protection per se. It's important to recognize there's some things with the antibodies to be aware of. One is that everybody's antibody levels will wane over time, and that's been seen with other vaccines as well. Our immune system is very complicated, and antibodies are only one portion of that. So, our antibody levels are responsible for helping defend our body if we get exposed to a virus or a bacteria. But there are other components of it to recognize that aren't reflected in that antibody level as well. We have another part of the immune system called T cells, and there are some memory cells so that they stay in place so that after, longer after we've been exposed to a pathogen or a vaccine, we still have the ability to call up defenses again. And so you can have antibody levels that decline, but you still have memory cells that are present that we don't have great labs for at this point. They're still doing ongoing studies to see how well antibody levels correlate with protection and clinical outcomes. But again, an antibody level is a lab, and clinical outcomes are really what we're most concerned about, right? How well does somebody do if they're exposed to COVID after they've received the vaccine? And there's some encouraging data looking at some patients that received solid organ transplants that even though they didn't have detectable antibody levels, they had received the full vaccine series, and when they were infected with COVID-19, they actually had better outcomes than patients that had received a solid organ that weren't vaccinated. And so that's real encouraging to kind of demonstrate what I just mentioned, that the immune system is more complicated. So they didn't have detected antibody levels, but they had other portions of their immune system that were still able to pull up that protection to give them a better clinical course. So I think it's important for people to recognize that so they don't get too concerned about their antibody levels. And frankly, I would mention that at this point, I would not get antibody levels to see where it's at, your antibody is at, because it doesn't reflect your total immune system. More important to just follow the recommendations and get the vaccines and the booster if you're a candidate for getting the booster. There are a lot of things still to learn about antibody levels, and unless you're doing it as part of a research study, I wouldn't recommend going out and getting your antibody levels checked. Antibody levels can vary depending on the time that you received the vaccine, which vaccine you received, other medical comorbidities or medical issues that you may have, your age. So there's a lot of factors that weigh in on where your antibody level might come out numerically, and we just don't have the data to correlate that with clinical outcomes. I think it's more important to focus on making sure that you get vaccinated and getting the booster if you're in one of those groups that's eligible to receive the booster. So some of the reason for the gap between the booster and the initial series is to address overall waning of part of our immune system, to try and boost up that response later. And we've seen similar things with the flu vaccine from year to year. There's changes in flu virus, there's changes in our response over time. It does tend to wane some. And some vaccines don't provide as durable response because of the nature of the pathogen or virus that they're protecting you against. And so in looking at people that had received the initial series of vaccine, there was concern that they may not have as high a level of protection as we'd like to see, even though these vaccines are really impressive. And so a booster has now been recommended for groups that are at higher risk for infection with COVID-19. And so that booster later on is to help boost up again the immune response to have it as high as possible for a longer period of time. So I think the main constant that we've seen with this COVID pandemic is a lot of change, right? There's been changes throughout. One of the reasons that we've seen changes in recommendation, and the primary reason we're seeing changes in recommendations as things move along, is because we're learning more about the virus that causes COVID-19. And so initially, there were recommendations that were made based on other similar types of viruses to try and provide protection, to try and sort out how do we best live with this virus or work against some of the horrors that this virus has caused while we try to learn more about it. As we continue to learn more about it, obviously we've seen the recommendations change. So certainly science is not perfect. Nothing is perfect. There are always issues and flaws. The important thing is to have this ongoing constant cycle where we review what we're recommending, see how well it's working while we continue to get more information. And as you get more information, the important thing is not to just sit on that, but to act on it to improve the processes, the things that we do to make things better for everybody. The most important part of this is to keep everybody protected. And so I think the importance of new recommendations is that it reflects that there's ongoing knowledge that's being gained about this virus and the pandemic, and there's better ways that we can more effectively prevent the infections and protect ourselves.